Today I'm joined by Dr. Erin Nance, an orthopedic surgeon and founder of Feel Better, a digital health platform that connects patients to share experiences and get personalized health advice. She's also a proud UVA Wahoo, and her unique journey blends hands-on medical expertise with a passion for innovation in healthcare. She's also become a prominent voice on TikTok, educating and empowering people on their health journeys, and is one of the most impressive people that I am really proud to get to say is a good friend of mine. So Erin, welcome. I'm really excited to dive into your story today.
Thanks, chat. I love being here. I love repping Care+Wear wherever I am. As I said, I told a chat, I have been wearing Care+Wear scrubs on over 150 million viewed videos. So
I love that.
Care+Wear is well represented on TikTok.
That's amazing. I was going to say also one of my favorite models who has repped Care+Wear even on Fox 5 and all over our website and marketing literature. So we're very, very grateful for you. So besides your modeling career, which really proud of and really proud to be a part of that, you've had a really impressive journey from the operating room to digital health. What drove you to launch Feel Better?
So, as a medical influencer, I sit in a really dangerous part of the internet. And that is someone who is an insider who still can call out the system that I work within. Because what was happening was I started my social media handle, Little Misdiagnosed, telling stories of my time in residency, interesting cases that I'd seen. And I was being bombarded with stories from followers asking for me to share their story because they were going through their journey of being misdiagnosed, of people not taking them seriously, of people brushing off their concerns. And what I realized was that there's a massive gap in experts' medical knowledge and how we transfer that to the patient. There is no way in a 15-minute office visit that a physician is able to listen to the patient, examine them, diagnose them, and then educate them on their condition. And what I saw was that the physicians online were really good at filling in that gap. But the problem was that those platforms themselves were untrustworthy and full of misinformation, as I'm sure most people have experienced if they've spent any amount of time on TikTok or Reddit or Facebook. So I really built Feel Better to be that safe and trusted place, to be a bridge between the medical experts and the people who were looking for credible medical information.
Love that. And I think I remember earlier, and we've known each other for a couple of years. So I remember when you're going through training and then residency and then real world scenario, et cetera. How has your surgical experiences prepared you for the challenges of being a founder?
Well, I'm come from old school surgery, pre 80-hour work week.
Yeah.
And I think the biggest thing is that I, in my training, had so much accountability for every patient I ever took care of. So if I admitted a patient that evening, I got all their tests done, I got all their consults done, and I would not leave the following day until they were, ready for surgery, everything was buttoned up. And I think that has really transferred over to being a founder in that I take ownership and accountability for all the decisions. If they're right or wrong, it doesn't matter. I'm the one who owns them. And I think that gives me the freedom to make those decisions and kind of move on.
Yeah. No, I love that. And then vice versa, how has your being an entrepreneur impacted the way you work as a surgeon?
So I think it actually has made me more creative and
Hmm.
open-minded, and this has a little bit to do with, my time as medical influencer as well. But
Yeah,
even though like I am a super specialized ninja, right? Like I can replant someone's hand.
yeah,
But I take so much pride in diagnosing someone with, an autoimmune condition. They
yeah.
may be talking about, they're having, or I'll just even pick up on they're having difficulty with their like breathing or something. And so I'm much more attuned to the whole body and the whole patient. And I think that has a lot to do with my history of being an entrepreneur.
Love that. So I think one of the coolest things about Feel Better is just how you're creating a supportive space for patients. And I think it's really inspiring. It's something that is so needed. In your opinion, why is community so important in healthcare, especially for those managing chronic conditions?
So I'll give you a little sneak peek of the TED Talk that I am giving this weekend in Charlottesville. But for people, and it's called the 7 stages of misdiagnosis.
Hmm.
And for people who have been misdiagnosed or are still undiagnosed or have chronic illness, probably the most important part on that journey is finding your North Star believers. And these can be family members, they can be friends, they can be doctors, they can be random people you meet online. But if you find people who believe you, then you can find people who can help you. And that's what it boils down to, what community is all about, right? And especially if you're able to find community of people who have gone through the same things that you've gone through. There's no need to explain why this is so difficult or why. They just get it.
Yeah.
And I've noticed this even, we ran a beta group for a year, and one of the users would say, wow, I just found these compression socks, they're amazing. And all 50 users would buy the same compression socks, right? Because they trusted that this person was just sharing something out of the goodness of their heart that they
Right.
think would be valuable for everyone else to know about.
Yeah. It's like the I hate to say the anti-influencer, but it's the person that is doing it because it helped them and sharing those insights. I know for Care+Wear, we oftentimes will see just amazing stories from people sharing their insights and sharing their stories and talking about how what they saw either on our social media and our website helped them in their day-to-day journey as well. And I think that's so important for people to know you're not alone and there's someone there with you. All
Absolutely. I mean,
right.
when it comes to your health, I say
Yeah,
every user is an influencer.
totally.
And that has borne out pretty much in every sector that I've seen.
Love that. So we've talked a lot about TikTok and influencers, and I think just in general, thinking about social media. Today, actually, pretty cool. Although I guess by the time this comes out, it won't be today. But I guess I should say last week, we launched our Care+Wear ambassador program, and it's something that we're super excited to but based on our work with people like you, right, that are known and trusted, that are providing advice to others, you've built an amazing following on TikTok. Like you said, over 150 million views. I think if I were ever on TikTok, I would probably have one view in the same time. So that's 150 million times better than me. And so impressive. But how do you think social media has changed how people learn about their health? And with the amount of misinformation out there, how can people make sure that they're getting the right information?
Uh, it's an excellent question and concern. Social media has democratized access to health information.
Yeah.
Whereas 30 years ago, the only people who had the knowledge were your doctors, right?
Right.
And it existed because I read textbooks that were this thick, and
Yeah.
I internalized, and I saw 1,000 patients, in the hospital, and I knew what to expect if someone was having chest pain or whatnot. Now we are able to hear other people's stories and
Right.
learn from them in real time. And
Yeah.
so I think for especially rare diseases and chronic illness, the people with the lived experience, they are the experts.
Yeah.
So part of the reason why I started Feel Better was to create a place where both medical expertise and patient experience was valued and accessible. So you need to have, both inputs. But I do think that, medical misinformation is probably one of, if not the most dangerous part about social media, period.
Totally.
And it's one thing to say, we want everyone to be able to share their stories and give their experience, but we also want some sort of moderation,
Yeah.
and we want some credibility, and science research back evidence as well. So that's why I think you don't have to throw the baby out with the bathwater, right? I think there's the way that medical information is being presented on TikTok in
Yeah.
short-form video, in storytelling, in creating community is really incredible. And if we can just add that layer of credibility, that I think would be the winning formula.
Love that. I remember you're talking about those textbooks. My mom's an anesthesiologist, and I remember the plethora of textbooks that were sitting in a bookshelf in our family room. And anytime there was any question, my mom would know which book to go to and what page to look at, which is just scary. But no, it's so true. So you've kind of alluded to some of this, but when you look at healthcare today, what are some of the biggest challenges that your patients face, and what new trends or innovations are you most excited about that could help them solve them?
So I think just from like boots on the ground, listening to my
Yeah.
followers, the biggest problems are cost and access.
Yeah.
It is not cheap to be sick,
Yeah.
and uh, even people who have insurance doesn't mean that you are going to get access to the care that you need.
Right.
So I think that is probably the biggest problem facing people today, which is why when I asked my beta users, what do you want? What do
Yeah.
you need? They said, we want and need non-doctor requiring, non-prescription requiring solutions.
Hmm.
Help us,
Interesting.
help us help ourselves.
Yeah.
Okay? Because they have been to all the doctors, they have been on all of the medications, they
Right.
have done all of the tests, right? So I think kind of the future of medicine is a repositioning of people from patient to healthcare consumer. And I believe that the companies that see people in this light and provide the products and the goods and the services so that they're able to be empowered to take their health into their own hands, right? Think of how many people now are wearing the wearables, the Aura,
Yeah.
the
Yeah.
Whoops and whatnot, right? This is
Yeah. I've
part of
got my
that
Apple Watch.
shift.
Yeah.
Correct. This is really part of that larger, shift in trends of healthcare. And whereas before it kind of was seen as health and wellness, right? I think there
Yeah.
is now a blending of health and wellness because there is so much more emphasis on consumers and patients taking their health into their own hands.
Love that. All right. I've got some rapid fire questions for you. What is your go-to tennis racket?
Oh, I have a Babolat. No, sorry, I
Yeah.
switched. I have a Yonex now. I have a
Okay.
Yonex.
I'm still on the Prince Thunderbolt from high school. It's depressing.
I used to have something called the Sledgehammer,
Oh,
and
I
it
love
was
that
like the
racket.
size.
Yeah. That was such a great racket.
It
I'm
was
not gonna
such a good
lie.
racket. You couldn't miss because the head
No,
was
the
this
head was
big.
so big. Yeah, I obviously play with an oversize. What is your favorite restaurant in Charlottesville?
CNO.
Sienna, great restaurant. What dorm did you live in your first year at UVA?
Courtney.
Cool. Oh, wow. I
I
can't believe we're friends after, I mean, if I had known that, we might not have been friends.
know.
You really got gypped on that.
Oh yeah.
If it makes you feel better, I was in Woody and then really liked having air conditioning. So leverage knowing my doctor to get a doctor's note
Yes,
saying I had
yes,
allergies. So I could
yes.
get AC and now I have allergies. So
Yeah.
karma's a real pain. Who's the healthcare TikToker that you love watching? Besides yourself, obviously.
I love Lady Spine Doc.
Yeah.
And I love Dr. Beach Gem.
Love it. What's your favorite children's book to read back in the day?
Well, I'll tell you a book that I just read with my daughter, which
Yeah.
in my mind, I remembered it as my most amazing book that I've ever read, which was called Number the Stars by Lois
Hmm.
Lowry.
Yeah.
And I still loved it, but it is funny how I feel like I probably should have left it in my mind as
Yeah.
as the child reading that book, but it is still
Yeah.
a great book.
And then what is your favorite karaoke song?
Oh, well, Only the Good Die Young.
Yeah. Great
Um,
one. We
yeah,
might have to get them to play that at our reunion in Charlottesville.
yeah.
Um, Well, amazing. I guess I should say Dr. Nance. It's still weird to say that, but Erin, it's so wonderful to have you on here. It's been amazing to watch your journey and just what you're building is so incredible. And I've been really blessed to have you as a friend that always says yes at all times. And I think it's how you treat your patients and you treat your fellow clinicians. And so excited to see how Feel Better grows and to see even more people wearing Care+Wear scrubs in your videos. And thank you so much for doing this with us today.
Oh, well, thank you. It was an honor just to be asked. And, I think that what you have built with Care+Wear is you have really created a healthcare company that puts the care back into the equation and that you really see people as humans.
Yeah, no, thank you so much. And we wouldn't be here without people like you. So it's a joint collaboration for sure.